And please tell me about the role of the CDC funding with the Tennessee Department of Health and how it helped you respond to this outbreak.
Well, this funding was absolutely critical in our response. My healthcare associated infection team includes 6 people who are funded through the Public for Prevention and Public Health Fund Epidemiology Laboratory Capacity Grant. That allowed us to have the staff who were trained to be able to ask the right questions, to create the questionnaire, to go and inspect the facility, to create the database, to analyze the data, and act quickly on the data in order to be able to identify the product and allow the product to be recalled so that no additional people were exposed.
When you went into the practice of medicine, did you ever think you would be testifying before a U.S. Senate committee?
No, I never would have thought that. In fact, I was a clinician through and through in Australia until in the 1990s I was involved in a horrific outbreak of MRSA sternal wound infections that completely changed my career. At that time, I felt completely powerless. I didn't have the right tools on how to do that outbreak investigation, and there was nobody who I could ask for help. The local health department was great in doing foodborne investigation outbreaks, but didn't have the expertise in healthcare-associated infection outbreaks. And so that is actually the reason I came to the US, to learn how to do outbreak investigations in healthcare-associated infections. So I came to the CDC as an epidemic intelligence service officer in the Division of Healthcare Quality Promotion in 2000 to learn how to do healthcare-associated infection outbreaks.
Okay.
It was MRSA infections causing sternal wound infections following coronary artery bypass graft surgery.
Okay.
And it affected between 30 and 40 patients. We had 3 deaths. Patients had horrendous complications, needed massive plastic surgery, massive muscle flaps. And literally that outbreak completely changed my career, and that's the reason I came to the US to be an epidemic intelligence service officer at the Centers for Disease Control.
And you look like you've gotten some rest, have you?
I'm now working 70-hour weeks instead of 100-hour weeks. So I have actually gotten quite a bit of rest recently. Thank you.
All right. Well, thank you for being here, Dr. Kainer. I appreciate your time. Anything you'd like to say to the folks back home in Tennessee?
I have an awesome team of people. My team is fantastic. The rest of the health department, I am so proud of the way that they have acted and how they have worked together on all of this. I'm just extraordinarily proud to be part of that organization.
Thank you.